Welcome to USMLE Sarthi. We are committed to empowering IMGs. We're excited to guide you on your match journey. Don't forget to click subscribe and turn on notifications so you can get notified whenever we add new content. Also, follow us on Instagram and Twitter for the latest tips and tricks regarding everything USMLE. Now, let's dive into it.
Good morning, good afternoon, good evening, everyone. This is the USMLE Sarthi team, and today we have a special webinar which is about opportunities in the US for physicians like you, all IMGs, who may or may not want to go through the residency path in the US. So, a lot of states over the years have come up with some provision or the other to leverage IMGs to get you the experience and to address the physician shortage. It is called limited license, some of it called provisional license, and there are at least 18 states that have some form or the other of these limited provisional licenses, and we are going to talk all about it today. We'll give you some guidance, some tips. Remember that a lot of these are still under works. A lot of states are refining it. A lot of states have started it. So the latest information sometimes can already be dated. With that said, couple of housekeeping items. As you can see, you will have opportunity to ask questions in the chat, and we will take questions towards the end. We have a lot of speakers, so we will take questions towards the end. I do have Sheila Nibar from our team, whom many of you know well. She is also there today, and Marina Bora from our team as well. So Marina is going to be, coordinating all of this, especially the limited license part, and Sheila as well. And we already have one speaker, Anchal Pandey, who's going to speak about the opportunities in Arizona. With that, let me give it to Marina to introduce herself, and then maybe Sheila, and then we will get started. So Marina, over to you.
Yeah. Hello, everyone. Welcome to the webinar. I'm from USMLE Sarthi. I'm from the operations team, and I'll be coordinating everything. Whatever you have any questions, you can ask in the chat, and we'll be replying you as soon as possible.
Thank you. Sheila, are you there?
Yeah, I'm here. Can you hear me?
Yes.
Hello, everyone. I have talked to a lot of you. I'm our VP. I've been here for 3 years with Sarthi. So excited to guide all of you and excited to talk about this topic too, because it's such a unique opportunity to be able to work without having to go through the residency. So I'm excited to hear what the speakers have to share with us today.
Okay. So Anchal, while you are here, why don't you just introduce yourself, and then, we'll get the details when it's your turn.
Yes, sure. Thank you. First of all, thank you, Pawan, for having me here today. Hi, Marina. Hi, Shaila. I'm really excited to be here today, and I would be sharing my experience and what helped for me while working in Arizona. So as Pawan already told that it's still under the process, the transitional training permit thing. So please free to Google if there is any information you want to know more, or if you have some discrepancies. Yeah.
Okay. Thank you. Thank you.
Thank you.
All right. So let's get started. So let me just kick it off. So what are these limited licenses or provisional licenses? So first up, Marina, if you can share our main link where you have the summary of all the states where they are looking for employment opportunities. That will help. So share the link in the chat so people can follow along if they want. But primarily, what this is, like I said, there are about 18 states, and we'll go over most of them. And Marina, if you can share the link. So if you go to this link, you will see there are 18 or so states that have this limited license, provisional licensing. A couple of key points that all of you should be aware. This does not mean that you do not have to do ECFMG certification. Almost every state will want you to do ECFMG certification first. So step one, step two, CK, OET, ECFMG certificate, all the requirements of the ECFMG certification need to be complete. Some states may want step three as well. So then certain states call it limited license, certain states call it provisional license, and there are differences in what you can do or what you cannot do. Certain states like Arkansas, Oklahoma, Missouri, they have assistant physician licenses. So a lot of our students have gone through the assistant physician licenses, which mean that you can work under supervision of practicing physician in their clinics, etc. And you can manage patients, all of that, and it helps you in terms of the USCE, so US Clinical Experience Equivalent, and then you apply for residency. That is one part. Some states give you this kind of a license where you work as assistant physician, and the expectation is that then you will go in for residency. There are other states like Tennessee and like Florida where you actually don't need residency, so you can start working right away. Some of these states like Florida or Tennessee will require a home country residency, right? So that is the difference between some of these licenses. So they will require home country residency, and here, of course, then you can start practicing. So then who's eligible? Do IMGs qualify? Yes, of course, IMGs qualify. That's why we are talking about it. A lot of it has to do with physician shortage. As you know, US is facing drastic physician shortage, especially in all primary care specialties. And these states are now trying to get IMGs in their fold. So all this is geared to that. And of course, a lot of states do want you to train. They understand that many of you who may have expertise in a special domain, you worked in your home country for maybe 10, 12 years as maybe a surgeon or maybe as a dermatologist, then, do you really have to go through residency and all of that? So that's why they come up. Now, which states are offering this kind of a license in some shape or form? Arizona, Arkansas, Colorado, Florida, Idaho, Illinois, Iowa, Massachusetts, Mississippi, Missouri, New York, Tennessee, Virginia, Washington, Wisconsin. So there are a lot of states. Like I said, there are at least 18 states. Okay. So the policy and the regulatory framework, and how you get opportunities in one particular state. Now, not a lot of this is transferable. So say, for example, you get approved in Arizona, does not mean that you get an automatic approval in New York. So a lot of it is not transferable. The criteria in each state can vary. But like I said, some of the common criteria is obviously you should have done your graduation from med school. It is not, you are not eligible if you're still a student. You should have passed your step 1 CK, gotten the ECFMG certification. And, in a lot of states, you will be working under supervision, and many states have these restrictions that you cannot do high risk procedures, high risk surgeries, all of that you cannot do. Okay. Most of the job opportunities here, now this is also important. You are going in for a job, so you look for a job. So most of these job opportunities are in primary care roles, maybe urgent care, maybe outpatient clinic, and we'll also go over some of those. rural clinics, they are specially open to these kind of opportunities. Then is the question of visa, right? Now, some states like Tennessee and Florida do visas, and we will probably talk about it. Other states, maybe only for people who have a green card or don't need work permit, even if you may be an IMG. So again, it varies from state to state. Okay. With that, let me see what else before I move on to Arizona. Yes, so I think the first state we want to talk about is Florida. So let me switch gears and show you what Florida looks like, and then we'll talk about it. Let me share my screen. And Marina, maybe you can share the link to this page as well. This is, I think, yeah. So this is our page for Florida, and Marina has shared the link. So what is the Florida opportunity? And we are, by the way, in Florida, we are working with a consultant. So if you go through Sarthi and if you are eligible, then they will take care of all of this. So the key points in Florida are the following, right? You don't have to do the residency as it says here. However, note that Florida means that you have to have 4 years of practice in your home country. So you have to have a valid license in your country wherever you are practicing. 4 years of practice, that is required. So if you are a recent YOG, you probably are not eligible. ECFMG credentialing or ECFMG certification, and the home country residency is a requirement. So for example, if you are looking to work in family medicine, you will either 4 years of work experience or residency. So once you submit your application to us, we will validate if you are eligible or not. But let's say surgery or dermatology and all of that, you are required to have home country residency in most cases. But what we are saying is, if you submit your form, so there is a form right here, and you don't have to pay anything, fill the form, and we'll check your eligibility, and then we can tell you if you're eligible, and then we can train you for this. So it is a full-time employment in Florida as a physician. There is a visa called H-2B visa, which gives you eligibility to work, and we are partnering with a law firm also, which will take care of the visa. Okay, the other thing here, which may not work for a lot of you, but maybe work for others, you need to have active license in some eligible countries. Not all countries as of now are on the Florida list. I'm sorry to disappoint, but a lot of people from India, for example, are not eligible as of now. So India is not on this list. I think Pakistan is also not on this list. But go to this page on our website, check, and then you can see. And like I said, these rules keep changing. You may see a change now that elections are done and all that. Maybe the new administration will make some changes. So we don't know yet. But this list is current as of last month. So you can see 4 years of work experience. You have to be citizen in that eligible country where this listed. Obviously, a graduate. In most cases, you should have completed applicable residency in the home country. But like I said, submit the form, then we'll see. They also have an additional requirement of step 3. So not only ECFMG certification, but step 3. So if you are eligible and all of that, then once you fill up the form and we confirm your eligibility, then we start preparing you for that interviews. How do you apply? What do you apply for? Interviews, mock interviews. We review your PS, the personal statement of some kind. This is not ERAS. So, the personal statement, non-ERAS CV, and then we work with our consultants who are going to push you for that open positions that are there in Florida. Okay, so go through all these links and then you can see if you are eligible. If you are interested, like I said, you don't have to pay anything, just fill up the form and we will get in touch with you. So that is the Florida opportunity. And now let's move on. And I'm seeing, our guests from Arizona have joined. So first, I want to welcome Anchal Pandey, who is our student and who's actually, working in Arizona on a limited license. And then I have another special guest, Mr. Jose Giardo, who we will be working with in Arizona for limited license, for inpatient rotations, for a lot of opportunities in Arizona. All of you know that I'm based in Arizona, so I have a special corner for Arizona and opportunities for all of you who want to explore it in Arizona. So Anchal, maybe we'll start with you.
Yeah, sure. Thank you, Pawan.
Let me get your camera. Can you?
Yes.
Yes.
Yeah,
So over to you, Anchal.
Yeah, thank you. Thank you for having me here today. And thanks for the insight on the Florida limited license. So yeah, I have worked for a couple of months in Arizona under the transitional training permit, which in Arizona it is titled as transitional training permit by the Arizona Medical Board. So I'll be telling about the steps of approval, who are the people who are who can apply for it, and then what is the eligibility criteria, how much time it takes to get it approved, and other questions. So starting with what are the documents which we need for the transitional training permit. So it's a two-step process. In the first process, we have to submit the USMLE step 1 and step 2 passed, as Pawan already told that it's a mandatory requirement. Then your medical transcript from the medical school. And then they ask for, in the last 2 years, if you have applied for a match, for residency match, they ask that they need a proof that you have not been matched anywhere. So basically, these are the 3 requirements. Along with that, later on in the application process, they ask for the work permit in USA, like you are authorized to work in USA, and then a fee of $50. So these are the basic requirements for the first step, which I submitted through hard copy. And then after submitting, it takes around 2 to 3 weeks to get it approved if everything is in place and they agree with all the documentation process. A coordinator is being assigned after submitting this application to tell if there is anything lacking or if there is any documentation which they need a more proof of. So in my case, I just want to tell if it helps for other applicants that when I submitted my last 2 years match thing that I have not matched when I applied, they told that this is not sufficient. And they asked me to submit the invoice of the programs where I applied and to double proof and they wanted it to be sure that this documentation is valid, that I have not matched. So yeah, so that was a learning point for me, and that's why my application got rejected in the first chance. And then I resubmitted with the help of the coordinator through the Arizona board. So this is the first step. So after it gets approved, then comes the next step, which I would say is the assigning of the supervising physician, which totally depends on us, like the applicants who are applying. So assigning of supervising physician is not in the hands of Arizona board. There is no list. There is no specific, specific physicians. I mean, you can't find it on. It's nothing to do with the board. So you have to fetch. I mean, you have to. Approach to your mentors through connections, through networking, so that someone agrees to supervise you. And then once we get the supervising physician, there is another form which the supervising physician has to fill up, stating that I'll be training this person, and these are the things, these are the clinical duties which this trainee will be carrying out under the direct supervision of the physician. And then the supervising physician submits this second form again to the Arizona board, which again takes around 2 to 3 weeks to get it completed. Yeah, so this is about all about the licensing process. And then another question is, can you apply to another states? Yes, we can apply to other states. If I'm applying for Arizona, it can be applied to other states. But as I told that I don't know everything about it, because when I came to Florida, as Pawan told, the criteria is different. There is different process of the different states, so that we need to check for different states what are the qualifying points for that.
So, Anchal, before I let you go, but thank you for this comprehensive overview. Before I let you go, so talk a bit about the kind of work you do, the hands-on and all of that, and how you think that'll help you in your residency.
Yeah, sure. So as I said, that everything is being supervised, each and every action is being monitored by the supervising physician. But because the clinical scenario and setup of the clinics is almost similar to that which we do during our residency training process. So it's like a setup which we get familiar to while working there, like the EMR system, whatever we have read in the to prepare for step exams, everything is in practical, different case scenarios like elder abuse, drug addiction, like how to deal with those cases. So I felt that just working for a couple of months, I learned a lot, because a lot of case scenarios I learned in practical. And yes, definitely, it also helped me for my step 3 exams in the solving the clinical scenarios questions.
Okay. Well, thank you. Thank you very much, Anchal. Thank you for your time. I appreciate it.
Thank you.
And before I move on to the next speaker, a couple of questions that I see. What does work authorization mean? If they say you need to have work authorization, could be green card, H4 EAD, work permit of any kind, US citizenship, or any work authorization, including J2, right? If a state has that. In terms of should you have ever applied to residency, it doesn't matter. I think application does not matter as long as you have not started a US residency. There is no opportunity, as far as I think I know, for MBBS graduates from India without steps. I think then you're talking about full-time research opportunities on J1, but I don't think any other this provisional licensing without ECFMG certification. But with that said, let me welcome Mr. Jose, who's our partner in Arizona, and he's also very passionate about helping IMGs. He's been doing it for ages now, and we are going to be starting a lot of inpatient rotations with his help to help all of you in Arizona, in Texas, probably in California as well. So that is coming in about a month. And meanwhile, he is also an expert in the Arizona transitional provisional licensing. So I invited him to talk about Arizona as well, all the opportunities that we will work with him on. So welcome, Jose. Over to you. If you can introduce yourself, and then we go from there.
Can you guys hear me? Can you hear me
Yes.
clearly? Okay, wonderful. Well, first off, I want to thank everybody for their time. Thanks, Pawan, for allowing me the opportunity to speak to the group. My name is Jose Gallardo. I'm a clerkship clinical program director here. I work with several IMG universities here in the Phoenix Valley and with certain other facilities out of Southern and Central California. I've been working on this going almost on 9 years, and have had the the pleasure of being able to work with folks and see them through their journey, right? And primarily focused all on IMGs. And so with the network and the relationships that we have here, specifically in Phoenix, we've been able to get our IMGs to have their inpatient rotations. I mean, literally rotating shoulder to shoulder with the US programs, and have seen, I couldn't even count them on my hands how many people have been able to make residency. And so that is something that we take a lot of pride on. You know, I live and operate my program here in Phoenix. So we provide, administrative support, the compliance, all the paperwork that needs to be submitted in order to be able to get cleared and badged by compliance, as all hospitals, all systems, all clinician groups are going to want compliance up front. And so we'll help you with that, right? A lot of times, especially IMGs coming from abroad or other areas, may have challenges acquiring the documentation that they're going to need. We'll provide you that support. Once you submit the paperwork to Sarthi, Sarthi will let me know, what you're looking for, then we'll provide you support. As I tell all my students that come here, even though you come out here and you're on your own to work on your careers, you're not on your own. You have my staff and myself, at the ready to be able to help you. I don't want you to feel lost. I don't want you to ask me the questions, because I promise you 99.9% of the time, I'll be able to resolve it with maybe a phone call, give you some instruction, or provide you the proper links. And that's what sometimes has been a bit of a challenge for students. They just come out here and they don't know where to go. Who do you call, right? And so that's one of the main things we want to be able to give you as far as support when it comes to rotations. Now, as Anshul explained the basics of the transitional training program, there's a few caveats that I just want to point out. You have to have your steps. You must have at least applied to residency, because they're going to request from you the declination letters, right? In order for them to be able to know that you were eligible for residency. Unfortunately, in that match cycle, that person did not match. And then at that point, you'll go ahead and provide it. And as they're reviewing their paperwork, we'll provide you the step 2. I actually have the other Jose Gallardo that's on here. It's not me. It's actually my IMG graduate, is a former student, was also same as Anshul, and we've been able to help place him with one of the clinician groups here. So one quick key thing on the training program, it is for 3 years with an annual renewal by your sponsoring physician, okay, for your medical oversight. So that's something that we would walk you through it in order to be able to best prepare you so that you're comfortable with what you're doing. And even more so, as Anshul said, there's not a list of groups out there saying, we want an IMG. It's really in the network. And I think that's where, Pawan and myself and our network will be able to give you a lot of support, because I have groups and physicians in private practice, primary care, and certain specialists calling me, Jose, do you have any graduates who are interested in getting their transitional license? We have a need. There's a necessity. There's a shortage of providers out here, and so we are fortunate enough to have a network of providers and specialists here and hospitals. And with Sarthi being able to bring in eligible candidates, we're going to do our best to connect the right people. Right? If we connect the right people and provide you the support, it's not only going to benefit the community and our network, makes us stronger with them, but it's also going to help those of you who are eligible and are interested in practicing and acquiring your licenses and or residency, right? I guess my point is this: primarily, you're coming to do your rotations and get in some inpatient, some in-hospital experience, get your letters of recommendation, get into residency. But if you have to go through an alternative path for a year or two, well, you can earn while you learn under the transitional program. And that's going to really help you stay relevant and even make you more attractive to residency the second or the third year out, because you've been relevant, you've been practicing, you're actually engaging and supporting an ongoing practice. So if there's any questions, I'd love to take them.
So I think the questions, and we have had, we will ask them to submit their questions on a form. So guys, if you have any questions you think of later, you can always fill up the form, that I just showed you, and let me show you again, just in case. So because that will give us full information about about you. some students are cutting right to the chase. What is the
Right?
average salary?
Yeah. If I can answer that question, that's something that you would discuss with whoever would offer you a position.
Right,
Clearly,
right.
when they ask me about a candidate, I have the roster of who our candidates are. I'm not just going to recommend somebody. We've worked with you. You're out here. We know who you are. We know your work ethic. We know your ability. And of course, we'll recommend you to the right fit. We want it to be a success, right? We want to make sure. And at that point, as far as salaries, that's negotiated between you and whoever's going to sponsor you for the program.
Exactly.
There's another quick question there from Zakir. You will need to take your step 3 later on, correct? But you're only requiring step 1 and 2 in order to be eligible and then have applied to residency prior.
Correct. Yep. Okay. So, as then questions come in, we will, obviously engage with you, Jose. But thank you. And I wasn't sure if your student who you help place.
Yeah, let me see if Dr. Hernandez, can you add your camera and maybe just introduce yourself, and if you could just maybe give a little bit on what your journey was in getting going through the process and how our support was able to help you get placed.
Hi, good morning. Yeah, thank you for having me. Thank you, Mr. Gallardo. Yeah, my name is Nicanor Hernandez. I graduated from UAG, Otoma, Guadalajara in 2022. I applied, I took step 1, I took step 2. Mr. Gallardo was my clinical director when I came out here, and I applied for match, and unfortunately I didn't match. So I moved to Texas. I was like, you know what, I'm done with medicine. But then Mr. Gallardo a couple months later reached out to me, and he's like, hey, you know what? There's this new license out here in Texas, a provisional, the transitional training permit. And he told me, there's a position available. You're a great candidate. And just with that, he helped me with the process. He did the whole, he supported me with the application, made it easy. He set up my interview, which I currently work with Gila Internal Medicine. And he made the transitional year training. He just made the process really easy. So, and as he said, there is a demand here in Arizona with providers right now. And with this license, now that I've been on it for a year, I applied to residency this year again, and my interviews have increased. They have increased. So I feel more confident that I'll get good news in this March. And again, I think it's a great permit. It's a great license because within the 3 months I started training, I learned so much that I'm currently right now, I started maybe 5 patients a day. And right now I'm seeing anywhere from like 18 to 25 patients a day. So it gets you hands-on clinical experience. How you said, you get to learn the EMR system. You get to understand how to manage patients. We have weekly educations once a week, just go over, certain topics such as diabetes, just to make sure we're updated on the guidelines. But again, if it wasn't for Mr. Gallardo, he's not just here to place students in the correct place. He's passionate. He actually cares. He makes sure you go to the right spot. Because of him, I have a better opportunity of matching this year. So again, I do think it's a complex process, getting the license, the permit, but with the help of Mr. Gallardo, I don't think there should be a problem with it.
Okay. There is a question.
Thank you, Dr. Hernandez.
Is Spanish a requirement? Now, I've been living in Arizona for 10 plus years. I think it's good to have, but I don't think it's a requirement. Jose, what do you?
Yeah, I would say that, I get students from India, from Europe, Canada, Mexico, and Caribbean. So not everyone speaks Spanish. Now, clearly the Phoenix Valley demographic is going to be, a lot of heavy Spanish speaking, but a couple of things that I've always told my students, especially those there's some that come that can't speak English, right? And so they speak the Spanish, they can't speak the English. And so they might be able to communicate with the patient, but then they'll have that miscommunication with the doctor. And so what I've told all my students, regardless of where they're from, listen, here in Phoenix, it is a melting pot. Our accents are beautiful. We all have our accents, and it's As long as we're able to present effectively to our providers, you'll have plenty of support. Let's use an example. If you didn't speak Spanish, there's going to be MAs there of support to the providers. So you'll have a Spanish-speaking MA. Of MAs, there's a good amount of that will provide the support. Don't let that discourage you from pursuing the career, because remember, the transitional training program, it's exactly that. It is a transitional program. It's something you're going to use as your stepping stone to strengthen your medical base, your knowledge, and to make yourself more attractive to the residency programs, because you've actually been practicing in lieu of doing something that you graduate, you don't match in your first round. Then what do you do? I'll share another quick story. I had another student who, Dr. Kareem Danaoui, he's in his third year of surgery residency. He did not match. And so he had to start making money. And so what did he do? He went and got a job as a server at a restaurant. And so I checked in on him. How are you, Kareem? And he tells me what he's doing. And I'm like, oh, absolutely not. Get over here. Helped him acquire his first assist. He volunteered for a year to stay relevant, to stay in the OR, and help them with all the compliance paperwork that he needed. And so I think that's what I want everyone who's on this webinar to take from this, regardless of whether you're in Canada or India or wherever. If you're interested in coming to Phoenix, you coordinate through our Sarthi partnership. We will help you up front to get all the paperwork first. The last thing because one of the things that we won't do is we won't just have you show up and then good luck. That's not the way we work. We're going to make sure that we have all the paperwork in order for us to be able to get you credentialed, badged, and have full access, right? Now there is a mix of the outpatient, inpatient, but we can get into those other details. It all depends on what your focus is going to be and the availability for any type of core or specialty that you might be looking at. But yes, back to answer the question, don't let not speaking Spanish stop you. There is a demand for providers out here.
Okay. Well, thank you very much, Mr. Jose. Much appreciate your time today. And we'll be very, very soon as students fill up the form, and then, you and I will talk. But thank you for your time on a Sunday morning.
Absolutely. Well, it's a pleasure. Thank you, everybody, for having me and for just listening in. Juan, if there's anything else you need, please let me know. We're just a phone call away, okay?
All right. Thank you, sir. Thank you.
Sir.
Thank you, Dr. Hernandez. All right, let's move on. So I do want to, take certain questions. So what is the pay scale? Remember, it's a job. So most of these jobs, like you get into any job, it can vary. It can vary on your skill. It can vary on what the needs are. It's a job. It's a transitional training. So once you are found eligible and once we place you, interviewing with the clinic, all of this will depend on those things. So let me show you the form again, which you should fill up. So Shayla and Marina, if you can send them this page again from our website. It says job placement without residency requirements. You can look at it. It has all the states. So Arizona, Florida, all the states, some, or not all, I guess, but most of the states, all are web page. But most importantly, this is the form that you need to fill. And then it helps us get to know you better, and we get in touch, and then we take it from there. All right. So that's what the form is, because once we know what your qualifications are, what your needs are, what your skills are, then we can go from there. Okay. So does USMLE Sarthi, Mr. Jose's team, help finding a sponsoring physician during the process? In Arizona, yes. Absolutely. That's where we are working with Mr. Jose. He and I have a network of physicians. We will help you find it. Okay. So yes, we do that. Any contact in New York. So again, when you say contact, a lot of states like Tennessee, Florida, and all, it's a multi-step process. We know your qualification, then we start working on that. form to ask questions. So form I already shared. Openings in Texas and Georgia. Like I said, once you fill up the form, then we'll work on it. Okay. Cost of living in Arizona. Costs are going up everywhere. It is not as expensive as where Shayla is living, which is Hawaii, or maybe where Surya is, which is New York. It's very reasonable. I don't know what you mean by cost of living in isolation, but Arizona is still very, very affordable. Okay, so let's keep moving on. Let's see what the next is. Okay, so the next is Missouri. Now, we couldn't get a speaker from Missouri. He was busy today. But Missouri, we've had a lot of our students graduate from Missouri and get into residency. So Missouri, Arkansas, Oklahoma, they work on something called assistant physician license. And if you go to our website, you can read more about it. There are a couple of panelists also, Sarthi panelists, who have gone through the assistant physician licenses, notably Dr. Chintav Shah, who couldn't make it today, but he was an assistant physician for a couple of years before he did his residency, and now, of course, he did his fellowship as well. So if you join us, we can pair you up with him. But primarily, they require ECFMG certification, and then you apply to the assistant physician, for the license to the board of these 3 states. Each is different: Arkansas, Oklahoma, Missouri. And once that is approved, then you kind of look for a job. So it's the same thing. You are looking for a job. Okay. Once you get a job, then under supervision, you work as a physician. That experience actually is equivalent to your USCE. So that's how Missouri, Arkansas, Oklahoma, they work. Again, very similar to Arizona. It is not a substitute for residency. It is a transitional license that you get for residency. So if you go to our page and from there you Google, the license board, you can look at the requirement. Now, I want to answer this question. So there are 2 different things we're talking about: the Arkansas, Oklahoma, Arizona, or Arkansas, Oklahoma, Missouri. Assistant physician is different from physician assistant. There is a question: do I need to go to school for physician assistant? So physician assistant is a different degree, right? So yes. But what we're talking about here is assistant physician, not physician assistant. Assistant physician. So for assistant physician, for these transitional licenses, you don't have to. And Shayla has sent you a link just now in chat. If you want to set up time with us to review your profile, and maybe you work on both these things simultaneously, residency and the transitional license. Like Mr. Jose also said, your rotations are important. So many of you are looking for inpatient rotations. So we will have those as well, especially in Arizona and Texas, etc. So all of this, if you need more, click on this link and set up time. Either Shayla or I will be happy to talk with you. Okay, so moving on, I want to move on now to New York, the state of New York. Many of you are in New York, and I think one of our speakers, Surya, I think is already here. So let me welcome Surya. Let me give him access to. Okay, you have access to the camera. How are you, Surya?
I'm good, Pawan. How are you?
Very good, very good. Thank you. So welcome, and why don't you introduce yourself, and then you can talk about limited licenses. I think you want to talk about New York and probably also Arizona, but yeah, go ahead.
Yeah. Thank you for this opportunity. Yes, I am also an international medical graduate. I'm applying for residency match this year. I graduated from India. I have some training experience from the UK. I've completed my residency in England and I moved here, completing all my steps as well. Most of my work experience in the United States has been in research. I worked in research associate across 2 universities, and I had also applied for the Arizona Transitional Training Permit, as Anshul and Jose explained perfectly. There's nothing for me to add on that, except that my application is still in process. So there was it's just that we have to make sure that the sponsoring physician knows all the details. There are physicians in Arizona who don't seem to know the details. So if the application is incorrectly filled from their side, we might have to redo the entire application over and over again. So that is a process. But currently now, there is also a limited permit license in New York that people can avail themselves to. So it is a different form of application in that you first need to have an active job offer from a hospital. Most often, these are nursing homes, New York nursing homes, where we can work at the capacity of an assistant physician, like you mentioned for Missouri, also called as a limited license in New York. So what they do is look for jobs, and what I did was look for jobs at a lot of nursing homes, and then they're always looking for opportunities for physicians and stuff, and then email the HR department saying that, giving a little bit of my background, who I am, what my training background is, and then they would offer an interview, and then it is them that sponsor us for the limited licensing process. As far as I understand, that is the process that I went through for a limited license in New York. But apart from that, I quickly moved on to research, and I can talk a lot about how to get a research opportunity in the US prior to doing residency. That is something I'm much more well versed with, I would say, at this point.
Okay, so yes, of course, please do talk about it. But I think I have a question here that probably you can answer. Is
Okay.
pre-residency in New York same as limited license?
No, it's not. So for limited license, it's the same requirements as Arizona Transitional Training Permit. They need at least a minimum of step 1 and step 2, and at least 1 year of work experience showing proof. The requirement in Arizona Medical Board that states that a candidate has to have applied for residency match and either declined or not matched that year, that requirement is not part of New York.
Okay, so in New York, you don't really have to have applied for residency. Anyone
Yeah.
can. Okay.
That's right.
So yes, let's talk about you said on research and all that. So yes, please, let's do.
Yeah, so I worked in the University of Rutgers for about 6 months at a research lab, and then I moved on to another lab in NYU Langone in New York City prior to moving to my current position, both as research assistant first and then research associate. I would say that for IMGs, gaining a research position is a much more amenable process in that there is not a lot of paperwork that was involved for me initially, even if someone is getting sponsored a visa in the future. To give a heads up, usually a visa is not sponsored head first. They would ask a month or 2 of the candidate's experience. And if they like a candidate, because all research labs work with a certain funding for themselves, so they can't just pay everyone that comes into a lab. So they usually like a little bit of experience shown to them in the lab, see that we are proactive, driven to learn more, and then they would apply for a visa for us. Most often it's a J1. How it works is work for a couple months or so, and then the university HR team will get back to us saying that you want to officially be part of the lab, and then we answer yes and a couple of forms. And within a month, J1 is a very quick process for research because it's sponsored by the university and not by the lab investigator themselves. So it happens quite quickly. But prior to that, a lot of research labs do like to give internship opportunities, which are not paid, but they do like to give internship opportunities, which can be a gateway to get into the lab as a research associate or research assistant or even a lab manager. These positions are available. What I did was, and several of other lab colleagues that also came and became a part of our lab did was, we looked at all the labs in different universities and looked at the PIs, what sort of research they did, what publications they had, found out what is most interesting to me and what would be most useful for me for residency and for application of residency as well. And then I emailed all those PIs. And then it's sometimes trickier to get a response. They do get lots of emails, so they don't respond to everything. So it's about 100 or so emails. And then once I did an email, I actually showed up. I actually showed up to NYU. I showed up to Rutgers, took my resume, and then I said I wanted to meet the PI. And that first thing they asked me was, "Did you send an email?" I said I did. I hadn't received a response. That's why I came in person. No one says no the first time you show up in person, to be honest. Like, just show my experience. I came to the US and I want to pursue residency, but I want to improve my application, and I also want to contribute to research in the meantime. Very straightforward interview process. And then they accepted me in the lab as a probationary 2-month trainee. And then within a month, they sort of like you, they get to know who you are. You also sort of realize where this is going on, and if I can do it for a long term until residency, and the visa process started. And in fact, I was also offered a PhD post that, but didn't take it. But then a lot of doctors who sometimes don't match during their first try and are still on research positions go on to do a postdoc fellowship without a PhD because they have an MBBS or an MD degree from India or any other country. You can directly also work as a postdoc fellow in a lot of research centers, including Johns Hopkins, Mayo, and Cleveland. But research for Mayo is very application oriented. They look at the application really well. So if someone's applying for research there, and they also prefer some contact within Mayo to actually give as a reference or recommendation.
Yeah. Well, thank you very much, Surya. Much appreciate this comprehensive on how to get into research position. So thank you. I appreciate it. And of course, your perspectives on the New York transitional license. So thank you for your time.
Thank you.
Thanks. All right, let's move on. And, I will have Marina from our team kind of summarize some of these states as well. I think we do have one more speaker from New York if he's able to join. But next, I wanted to show you Tennessee, right? So Tennessee is the state where, everyone wanted to know what they are doing and how IMGs can work as physicians in the US without residency. So they started, technically they started in July of 2024, but they've been very, very slow off the blocks. There are still some issues I think they are trying to resolve. But first, if you can go to this page, we do have a blog here. So Marina, if you can share this page, USMLE-Sarthi.com, Tennessee New Law. Primarily, Tennessee is not a quote unquote transitional license. Here you can actually work directly. So what they are trying to do is the following, right? Obviously, ECFMG certification, as you can see, is a requirement. That is one. But they are very clear in saying that you should have completed a 3-year PG, which is a residency in your home country and or fellowship. So that is a requirement. So with that, what you do, of course, you can set up free profile if you're eligible. Yeah, so here's the link. But then you are allowed to work in the institutes that they have identified. So these are the institutes in Tennessee. So what they are saying is, if you have a home country residency, if you have ECFMG certification, and I think if you've worked for at least 3 of the past 5 years outside US. So, 3 of the past 5 years outside US, then you are eligible to work as a physician in these kind of programs. All of them have residency, and that's their requirement. So Tennessee is slightly different in the sense they have identified the institutions that you can work at, and of course they will do the visa. But like I said, Tennessee has been very slow off the blocks. There are some legal issues they are still dealing with. So we are trying to find out more about Tennessee at this point and what they are trying to or where they are in this, right? Again, Marina, if you can share the link to the page where they can fill up our form. I think a lot of students want to fill up the form for Arizona. So if you have our Google form link, and Dipesh is saying Tennessee opened the application. So yes, Tennessee applications are open. It's just that we have seen a lot of delays. But if you go to this page that I shared, and if you want us to help you with that, just fill up the form, and we'll help you with Tennessee as well. Okay. With that, I do want to give it to Marina. So Marina, if you can share your screen, summarize everything and how we can help the IMGs. So Marina, are you there?
Yes, sir. I am. Hi,
Okay.
everyone. Yeah. So as Pawan sir already told you about all the states, and the speakers have already told you about all the states. Now I'll be telling you how Sarthi will help you in getting you placed or to help you work in the US without residency. So okay, I'll be sharing the screen.
Yep. Should be a screen share option. And we have already shared this link in the chat. So any one of you, you can go there. So yes, Marina. So yes, this is the same page that you just saw.
Yeah. So we have already spoke about almost like few states like Arizona, Florida, Missouri, Tennessee, and all. So how Sarthi can help? We have a package or services that we're providing you. The first one is 1 hour strategy session with physician mentor. The second one is 2 mock interviews, including oral and written feedback, and 1 hour meeting to discuss your resume or CV and improvements with physician mentor. So these are 3 things we'll be helping you with. And the process is you just have to fill this form. You can get this form on our website, and I have already linked it in the chat as well. So you just have to fill this form. So this is the form. And after filling it up, we'll be getting in touch with you. And we'll be letting you know what are the other requirements, and we'll be letting you the other process, the further process. And for the this thing, the services, Pawan sir will let you know in details, like what all will provide you.
Yes, and this page links to the other states as well, and we'll soon put links to the state board requirements, etc., on each one of the states. I know we have for some. The link for the other states will also be put in. So again, step by step, what you should be doing is fill up this form. That is the first step. And once you fill up the form, we will review the eligibility, right? So whether it's Arizona, Tennessee, Florida, etc., we'll review the eligibility. And then if you are interested, so we'll get in touch with you. So if you are interested, say in Arizona or Florida or some of these states, then we can start, working with you. And if, for example, you want to get trained for Florida, and so we'll connect you with our consultants there, and in terms of interview preparation and all of that. If you want to do in Arizona, then it's a different process. But all of this will be first if we know the details about you. So this form on our website that Marina has shared, that's what you need to fill up. Massachusetts, we are still finding, I think there may be still more information on our website, so you can look at it. I couldn't get a Massachusetts speaker today. So unfortunately, I don't personally have done it, but yes, Shayla has just posted this Massachusetts requirements that you can see. So we will work on each and every state's requirements, but like I said, Arizona is very promising at this point. Florida, Tennessee, some of those states we can definitely help with. And by the way, I think we have our speaker from Missouri. Renexi is here. So let me see. Renexi, can you share your screen? Are you there?
I'm here.
All right. Thank you very much for joining. I know you are working today, so I appreciate your time. But yes, please introduce yourself and let our audience know about the limited licensing opportunities.
Okay, so my name is Aaron Randy Gauthier. I graduated from AUA College of Medicine in 2016. And since then, I've been doing limited licensing opportunities, not only in New York, but also Missouri. So for those people who need information, in New York State, you can do a limited license permit to study to be medicine under a supervising physician for 4 years only, though. That's the only thing in New York. They only do 4 years, right? And you're able to work as a doctor in almost every capacity. Of course, naturally, you won't be an attending, but it'd be from surgery, internal medicine, pediatrics, you name it. But it's always under a supervising physician, and New York State gives you that leeway to do that for 4 years as well, right? And so I was in New York. I worked under surgery for 4 years. Working that was very fun, by the way. That's the one I would like to get into. But also, after the 4 years, naturally, they don't really let you renew, right? And so you have to kind of try to find different ways to, keep yourself active as far as medicine. So I did clinical rotations, of course, with Sarthi. I went to Chicago for surgery, and also I did transitional internal medicine in Hackensack with the Sarthi program. It was good. So, thank you for those experiences as well. But also now, what I also found out is Missouri, they have what's called an assistant physician license. This has been open since about, I think, 2021. So I haven't really did it, probably because, you always have the impression that, one of these things is going to come through and you're going to get in. But unfortunately, that just wasn't my case. And so I applied. You go to the Missouri Board of Healing Arts. There's a section down for assistant physician. You click on it, and the best thing you do is you have to apply for the license first, actually, before you get the job, right? So you apply for it. So around here, around where I'm at, I'm in a clinic, and I work as assistant physician in urgent care, but I do a lot of primary care stuff as well. And I've been working since about July, and it's been a blessing, just kind of, keeping your skills up. I still do sutures and kind of, also procedures as well. But I'm also learning more of the primary care aspect and internal medicine, which is what I actually used to do also in New York. Because even when I worked in surgery, doing podiatry, I had, podiatry, they couldn't sign patients under them. And so I had to also do the internal medicine aspect for podiatry patients. So I was well aware with, caring for diabetics and all those type of stuff. And yeah, so that's what I'm doing out in Missouri. I think there are places in Columbia, Missouri out here. It's called the Columbia Urgent Care Clinic. In fact, we might be looking for some people in about 2 months after the match if you guys didn't match. So you guys need to reach out to me, let me know, and I can definitely get you connected as far as possibly getting you to work. But I would say that you have to actually get the process going. I think I saw a question as far as how much you get paid.
Family, that's a question everyone wants to know first. So you don't just give us a range.
Listen, Pawan, I'm pretty straightforward. It's okay. In New York, just in New York, you can get paid actually well because naturally you have to because of cost of living. So you can get an average about $70,000 to about even $90,000 for limited licensing opportunities in New York as far as medicine. Out here in Missouri, it's a completely different story. So one, the cost of living is not high at all, right? So, and I'm just giving you some context for New York, for New York City, a 3-bedroom, the one that I have now, you're looking at about 32, maybe 3,500, right? Give or take. Out here, it runs about 1850, maybe 1900. So that's huge difference, right? So I guess you can see in regards to the pay rate, you're going to get the same way as well. Out here, at least in the position that I'm working now, to be honest, it's actually paid per patient. So I'm not gonna lie to you, the attending or he's doing his thing. He's doing his thing because if there's no patients, you don't get paid. If there is patients, you get paid. But at the end of the day, you're looking for the experiences. So my encouragement to you is if you're coming out here, do it for the experience. I understand people have families. I have a family, I have a wife, I have a daughter, so I understand that as well. And you can make enough to actually do a basic cost of living here. But to think that you're going to be, I would say, thriving, I don't see it. Just to be
Yeah,
honest,
that's not
right?
the intent. That's not the
Exactly, for one. It's not the intent. But I think there's one in Columbia. There's also, I heard some in St. Louis as well, Missouri. So they're different places. And to be honest, just like New York, they're kind of hard to find. So with the Missouri licensure, a lot of times this is a new program that they're starting to build up. And I think the state is kind of getting more familiar with the actual position of assistant physician. And so to be honest, there hasn't been that much opportunities opened up yet. But I think in time, as there's more of experience, more of timing passing as far as good reports, I think more jobs will actually be opened up to us. But right now, it seems kind of limited as far as certain places that you can go.
Yeah. Well, thank you very much. I appreciate your time on a Sunday. I know you have a family and busy, but thank you, and thank you for providing your insights, and appreciate your time.
Of course, and if you have any questions, anybody can contact me.
I would have them contact us, and otherwise you will get slammed very, very quickly.
Oh, sorry. Okay.
So,
okay.
Yes, please fill up the form, and then we'll go from there. So please don't contact the panelists directly. They're all busy and they're working. So I am very sensitive to all the panelists' time and all that. So.
Well, thank you for correcting me. I almost gave my number.
No, thank you. I appreciate it. Thanks. Bye.
You're welcome. Bye.
All right. Last but not the least, we have another speaker, Dr. Nirav Shah, and he has been working in New York. So I think, Nirav, are you there?
Yeah, I'm there. Can you see me? Is it possible?
Yeah, well, if you can share your.
Yeah, just a minute. I'm just struggling for that. Just a minute where I can.
Let me see if there is a problem, but I think you should be able to share.
Yeah, just a minute. Yeah, I should be able to share. 1 minute. I just came in, so.
Yep. No, that's fine. That's fine.
Just a minute. Why I'm not able to. દ્રષ્ટિ મને આ વિડિયો ચાલુ કરે ને બેટા.
All right, as he is getting, you set up.
Okay,
All right,
yeah.
thank you.
Now it is there. Yeah.
Yeah. So why don't you introduce yourself and then tell us your experience about the transitional license.
Yeah. So I'm Dr. Nirav Shah. I have done my graduation and post-graduation from India. I did my MBBS and MD in OBGYN in 2002. And 2003, I started my own practice and I was practicing since then. So I moved to US last year on green card basis with family. And I've had I joined USMLE Sarthi in the Platinum group, and then I applied for some residencies, but it did not work out. One thing was there that I had given step 1 and step 2 very long back. That was in year 2000 when I was doing my internship. So that is when I got my ECFMG certificate, but I was not sure whether it was still valid or not. So I just wrote to ECFMG before I joined USMLE Sarthi, and they said that it's good to go. It is for lifetime. You just have to apply for residency, give step 3. So that is how it was. So I applied, and then I was supposed to go back last year. But then this came up for limited license. I came to know that New York is a state which offers limited license to IMGs. So I went through a company which told me that yes, a limited license can be issued from our end, from the New York Medical Board. For that, there were certain requirements which was there. They do appoint them there as an clinical assistant, and then you apply for the limited license at New York Medical Board, and they give it as a limited permit for 2 years, and that is what I got it in this May 2024. So it is valid for 2 years, and I can work, and I'm working at present currently in a New York-based, Bronx-based nursing home. So that is how it is, like it is going. But yes, it gives a lot of clinical experience. That is what I have seen. So actually, you're practicing as an internal medicine, as a physician provider. So that was one thing which, till I'm getting into this residency and all this program, like something to come up with, something to get a clinical experience.
Yeah. And have you tried Tennessee or any other state?
Yes, I did call Tennessee board. Actually, they were in the process. The law has been passed, but
Yes.
I think it's in the certain Senate problems or something is there which is going on. So they have still not started
Correct.
applications. So they are going to put up a form which will be there. You just have to apply it online, but they have not done it. This was, I'm talking about, I think 1.5 months back only. I had called them and they said we are still not ready for that. So they might be going in for, I think, 26, probably January 20. But nobody knows that. We still don't know that. How is it is going to work out? So
Yeah, Tennessee has been a bit of a slow
yeah.
start. We are all waiting for that. Any other tips that you have, Nirav, for anyone who wants to do a transitional license in any state?
I think this was a good thing. I can say that because I'm in New Jersey, I think it is more easier for me as a New York. But definitely, I've seen many other people who come in to New York or stay nearby New York and get this limited license. The only thing which is most important, because I can tell you one thing, for the last year, the company which I'm working for, there were 15 or 16 limited license practitioners were there, and all of them got into residency. This is, I'm talking about last year. There are other criteria, I don't deny that, but having a license with an NPA number does definitely help. So all of them got into residency. I have not been into contact with anybody. I don't know them, but that is an official data which they published from their company, that these were the LPs and they got into this thing. It does help. And I think more important than that is that you remain in touch with the clinical side, which I think it's very important. Like I have seen many people having very good scores, everything. But when it comes to interview, when they ask something very practical, which we are never exposed, all IMGs, we are never exposed to any kind of this thing. And that is where we like set up, fall back a little bit in that sense. So I think it really helps. And regarding money, you get something also, like you feel that you're working and you're getting something, not doing anything and sitting back. So yes, I think that helps. You're
No,
into the
absolutely. If you have a license number and PIN, that helps. So, and like you said, the hands-on experience of
Yes.
being able to be clinically active and in the interviews as they are discussing your experience, I think that's a big draw. So, a related question, do we get to see patients by ourselves? So, how does this patient management work on a transitional license?
Like it's same as a full license. Only thing, there are only certain things which is like you have to put a name. Suppose if I'm scribing a note, so my name is there, but I have to put a supervisor name also who is having a full license. That's the difference. There is no change in anything. You prescribe medications, you see the patients, you order consults, you see the consult, everything is the same what a full license provider is doing. Same thing, everything, the power is the same. Only thing is the category of that is a little bit changed. That is the only thing. So
Right.
that experience which comes to you as an independent physician, right? So I'm the supervisor which I'm working with is a full license, right? So what he is doing, the same thing I'm doing, right? He's also assigned one floor, I'm also assigned one floor. Only thing is that with my name, his name has to be put in when we are scribing, because the insurance companies recognize LPs as a dependent to somebody. So that's the only difference. There is no other difference. Rest everything you are doing the same.
Well, thank you. Thank you very much, Nirav. I appreciate your time
Yeah.
and, insights into the New York process. So thank you. and good luck in your future endeavors.
Thank you. And anytime.
Thank you.
Be there. Yeah.
All right, let's move on to the other thing that we wanted to discuss. So let me share my screen here in a minute, and then we'll answer any questions that you may have. So give me 1 minute, and we'll do that. Okay, so for those of you who are interested, in going into rotations research or residency match, so this is our website, and I of course have Sheila and Marina here. If you are planning for a match next season, go to our website, set up a profile review with us, and we can take it from there. Clinical rotations, this is our page. A lot of inpatient rotations, outpatient rotations. So click here and you can also see rotations that you will need for match in the upcoming season. We also have 3 separate courses on research for those of you who want to do remote research. So these is all remote research. So you can do it from anywhere. They all lead to publications, and they have different scopes. The PIs are different. So, for example, the innovative residency research PI will give you a letter of recommendation also. So it comes with an LOR that you can actually use if you want to use for your match. He's a former program director. The concept to publication is handled by Director of Clinical Research at Hackensack, Dr. Weissman. So, you can do a manuscript with him, or you can do an abstract publications as well. So, if you are interested in residency match, rotations, research, of course, in addition to the limited licensing, Sheila, if you can post these links, especially of the profile review. So if you guys want to know where you stand, what you need to do, set up a profile review with us, and we'll be able to help you assess what you need to be doing for your upcoming residency match, because all of it, the transitional licensing in most cases is a transition to the residency, like Jose also mentioned. So how do you prepare for that? We will talk about it. With that brings me almost to the end of today's webinar. So hopefully it was useful, but if you have questions, now would be the time to ask on anything around residency match, rotations, research, whatever we have on limited licensing over and above what we discussed. If you have a questions on anything post, you can post now. And Sheila has posted the links for our new inpatient rotations as well. So they are in New York, Texas, Maryland. But if you have any questions, if you can repost, let me see what questions. Do I have to renew my ECFMG certification for limited license? So again, like I said, each state is different. You do need ECFMG certification. If it is coming up for renewal, say in the next couple of months, yes. So you need active ECFMG certification for this. Arizona, we will provide complete help. We will connect you with the physicians for interview also. So yes, in the job placement, Jose and I will be doing that. We plan to do that also for Missouri, also for Florida. Tennessee, we're still not sure, but we will definitely. There are 2 steps: helping you prepare for the interview, getting your CV and any kind of statement of purpose right, and then connecting you to get the interviews. So yes, we'll do that. What other questions? I am doing my post-graduation or IMG graduate post-graduation done in 2003. If GC is expected in June. So yes, if you have green card expectation in June, you definitely can hopefully apply for Florida and or Tennessee in addition to Arizona and others. So does USMLE Sarthi help with limited licensing process in New York? So I don't know yet. So we'll have to see what your profile is and fill up that form that we said, and then we'll get back to you. Interview in Arizona for temporary license. So the license itself does not need an interview. That's a process done completely online. But for jobs, yes, you will need to interview with the physicians, and we can help you with that. Temporary license opportunity available in Texas as well. So go to our website. I'll have to see which hospitals. But if you fill up the form, we can get in touch with you. Michigan limited licensing opportunity, I am not aware. Maybe they have started, so we'll update our website. I'm a Canadian, have been GP in Iran. So it depends on the citizenship or the license. If you have GP in Iran, so fill up that form because we'll have to run it by our attorney. Because if you're a Canadian but you had worked as a GP in Iran, does it help you in Florida? We'll have to get our attorney on to check your availability. For those who are on F1 OPT status, F1 OPT status may be eligible to work without work authorization because OPT, but again, it will depend on the state, whether your OPT and what was the scope of that OPT, because OPT you can get in different shapes and forms, right? So whether it was for learning English versus some kind of an MPH versus something else. So average payment during this transitional phase, as one of our speakers said, in New York, it could be between 70 to 90,000, 70,000 to 90,000. In other states, depending on the cost of living, will be less. Like Missouri will be less than 70,000 because cost of living is less. OBGYN limited licensing, I guess your best shot is going to be Tennessee or Florida. Because like Nirav also said, he's an OB-GYN from India, and in limited licensing in New York, he's in primary care. So for those of you who are posting or asking about limited licensing opportunities in different states, go to our website. Those are the states that we've been able to research. If there are other new states, we will definitely update the website and let you know. Does USMLE Sarthi help job placement in Missouri? Yes, if you fill up the form, we will. Can I have the link again for limited licenses, the blog or the page? So Marina, if you can send the main page where we have all the states, and then they can navigate. J1 exchange visitor visa for research. No, this is not valid for work permit. So J1 visa is for research, is only for research where you are doing. That's it. Why does someone doing a residency in Canada want limited license in US? Because residency in Canada, they may want to do a residency in the US. I don't know. Do you have to work in underserved area in Arizona? Not for limited license. Even in Metro, Phoenix, Scottsdale, and all that. you can get a job. There is a lot of need. So no, the underserved area primarily comes if you are looking for a waiver job in the after residency. I'm doing GP training in UK. Can this help me in residency? So we have a lot of students who have done or are doing GP jobs or even residency in UK. UK training does really help in residency. Fill up the profile review form and we will help you. Shalla posted the link to the profile review. So we will. Is psychiatry residency IMG friendly? It is relatively IMG friendly, although it has become very, very competitive in the last few years. Fill up the profile review form. We will get in touch with you and get you started if you are interested in psychiatry residency match. Okay. All right, with that, we are coming to an end of this webinar. Thank you, everyone. Which specialty is IMG friendly? Last question that I'm going to take. Most specialties, primary care, IM, FM. Other than that, neuro, pediatrics, psychiatry, pathology. 5 or 6 of these specialties are very, very IMG friendly, but it does not mean that you cannot match in general surgery or others. You absolutely can. Just set up a profile review with us if you are interested, or go to our YouTube channel. We have a lot of videos there. So Shalla had already posted the link. All right, with that, thank you all who joined us today. We will have another webinar next week, which is focused only on rotations. I think we have a webinar coming up on inpatient rotations. There is also on research opportunities and all of that. So in the next 2-3 weeks, we have several webinars that will help you prepare for residency match. So subscribe to our YouTube channel and follow us on Instagram. There you can get information on all our upcoming sessions. So thank you and have a good rest of your weekend, everyone, and we'll be in touch.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.